What is a stroke? Imagine the intricate network of blood vessels in our brain, a complex highway system delivering vital oxygen and nutrients. Now picture a sudden roadblock, cutting off the supply to a specific area. That, my friends, is a stroke, a brain attack. It's a time-sensitive medical emergency where every second counts. Understanding stroke is crucial not just for ourselves but for our loved ones. Knowing the warning signs, the risk factors, and the importance of immediate action can make all the difference. It's about empowering ourselves with knowledge that can potentially save lives and improve outcomes. Throughout this video, we'll delve deeper into the world of stroke, exploring its types, causes, treatments, and prevention strategies. We'll unravel the complexities, separating fact from fiction, and equipping you with the information you need to make informed decisions about your health. Let's begin. A stroke, in its simplest terms, occurs when the blood supply to a part of the brain is interrupted or reduced. This deprivation of oxygen and essential nutrients leads to brain cell damage and malfunction. Imagine a bustling city suddenly plunged into darkness due to a power outage. That's akin to what happens during a stroke, where a specific region of the brain is starved of its vital resources. There are primarily two types of strokes: ischemic and hemorrhagic. An ischemic stroke, the most common type, happens when a blood clot blocks an artery supplying blood to the brain. Think of it as a traffic jam in our brain's intricate highway system. On the other hand, a hemorrhagic stroke occurs when a blood vessel in the brain bursts, leaking blood into surrounding tissues. This rupture disrupts normal brain function and can be life-threatening. Time is brain when it comes to stroke. Recognizing the symptoms and seeking immediate medical attention is paramount. Remember the acronym FAST. It can be a lifesaver. F, face drooping. Does one side of the face droop or feel numb? Ask the person to smile and observe for any asymmetry. A, arm weakness. Is there sudden weakness or numbness in one arm? Ask the person to raise both arms and note if one arm drifts downward. S, speech difficulty. Is speech slurred or difficult to understand? Ask the person to repeat a simple phrase and listen for any abnormalities. T, time to call 911. If you observe any of these signs, even if they are fleeting, call 911 immediately. Don't wait. Every minute counts. Other symptoms may include sudden confusion, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance, and a severe headache with no known cause. Understanding the underlying causes of stroke is key to prevention and effective treatment. Several factors can contribute to stroke risk, some modifiable through lifestyle changes and others requiring medical management. High blood pressure, often dubbed the silent killer, is a major risk factor for stroke. It's like constantly driving with a foot on the accelerator, putting undue stress on our blood vessels. Smoking, another modifiable risk factor, damages blood vessels, increases blood pressure, and reduces oxygen carrying capacity in the blood. Diabetes, high cholesterol, obesity, and physical inactivity are also significant contributors to stroke risk. Non-modifiable risk factors include age, gender, family history of stroke, and previous stroke or transient ischemic attack, TIA, often referred to as a mini-stroke. The treatment landscape for stroke has evolved dramatically, offering hope and improved outcomes for patients. The key is timely intervention. For ischemic strokes, clot-busting medications like tissue plasminogen activator or TPA can dissolve the clot and restore blood flow to the brain. However, this treatment must be administered within a critical window of time, typically within 4.5 hours of symptom onset. In some cases, a minimally invasive procedure called mechanical thrombectomy may be used to remove the clot directly from the affected blood vessel. This involves threading a catheter through an artery in the groin up to the blocked artery in the brain, where a device is used to capture and remove the clot. For hemorrhagic strokes, the focus shifts to controlling bleeding and reducing pressure on the brain. Medications may be given to lower blood pressure, reduce swelling, and prevent seizures. The journey after a stroke can be challenging, marked by physical, cognitive, and emotional adjustments. The extent and type of long-term effects depend on the severity and location of the stroke. Some individuals may experience paralysis or weakness on one side of the body, known as hemiparesis, speech difficulties, known as aphasia, vision problems, memory loss, and emotional changes. Rehabilitation plays a crucial role in post-stroke recovery, helping individuals regain lost function and adapt to their new normal. Physical therapy, occupational therapy, speech therapy, and psychological counseling can significantly improve quality of life and independence. Remember, recovery from stroke is an ongoing process, and with the right support system and unwavering determination, individuals can make remarkable strides. The good news is that many strokes are preventable through lifestyle modifications and proactive healthcare. It's about making conscious choices every day to safeguard our brain health. One of the most impactful steps is controlling blood pressure through a healthy diet, regular exercise, and medication if needed. Quitting smoking is another crucial lifestyle change that can significantly reduce stroke risk. Equally important is managing other health conditions like diabetes, high cholesterol, and obesity through medication, diet, and exercise. Incorporating regular physical activity into our routines, at least 30 minutes most days of the week, not only benefits our overall health, but also our brain health. The field of stroke treatment is constantly evolving, with researchers and clinicians working tirelessly to improve outcomes and minimize long-term effects. One promising area of research is neuroprotection, which aims to develop therapies that protect brain cells from damage during and after a stroke. Clinical trials are underway to evaluate the effectiveness of various neuroprotective agents in reducing stroke-related brain injury. Another area of advancement is in rehabilitation therapies. Robotic-assisted therapy, virtual reality-based rehabilitation, and brain-computer interfaces are showing promise in enhancing motor recovery and functional independence after a stroke. Diagnosing a stroke quickly and accurately is crucial for initiating prompt treatment and improving outcomes. It often involves a multidisciplinary team of healthcare professionals, including emergency physicians, neurologists, radiologists, and nurses. The first step typically involves a thorough medical history review and physical examination to assess symptoms and risk factors. Neurological tests may be conducted to evaluate motor function, sensory perception, coordination, balance, vision, and speech. Imaging tests play a critical role in confirming the diagnosis and determining the type, location, and extent of the stroke. Brain scans are invaluable tools in stroke diagnosis, providing detailed images of the brain and its blood vessels. They allow physicians to visualize the affected area, assess the extent of damage, and differentiate between ischemic and hemorrhagic strokes. This information is crucial for determining the most appropriate treatment approach and predicting potential long-term outcomes. Two commonly used brain imaging techniques in stroke diagnosis are computed tomography, or CT, and magnetic resonance imaging, or MRI. A CT scan uses X-rays to create cross-sectional images of the brain, allowing doctors to quickly identify bleeding in the brain, known as hemorrhagic stroke, or areas of damaged brain tissue, which indicate ischemic stroke. MRI, on the other hand, uses a strong magnetic field and radio waves to produce detailed images of the brain. This method provides more sensitive detection of subtle changes in brain tissue and blood flow. MRI can also help visualize blood clots in blood vessels, assess the extent of brain damage, and guide treatment decisions. After a stroke, a simple act like swallowing can become challenging due to muscle weakness or paralysis. A swallow test, also known as a video fluoroscopic swallowing study or VFSS, is essential to evaluate swallowing function and identify any difficulties. During the test, a speech-language pathologist observes the swallowing process using X-ray imaging while the individual swallows different textures of food and liquids. The results help determine if there is a risk of aspiration, which is food or liquid entering the airway, and guide recommendations for safe swallowing techniques and dietary modifications. Because the heart and blood vessels play a critical role in stroke, specific tests are necessary to assess their health and identify any underlying conditions that may have contributed to the stroke. An electrocardiogram, or EKG, also known as ECG, records the heart's electrical activity, detecting any irregularities in heart rhythm that could increase stroke risk. Blood tests may be ordered to check for cholesterol levels, blood sugar levels, clotting factors, and other markers of cardiovascular health. These tests provide valuable information for managing risk factors and preventing future strokes. The carotid arteries, located in the neck, are major blood vessels that supply blood to the brain. A carotid ultrasound scan uses sound waves to create images of these arteries, allowing doctors to assess blood flow and detect any narrowing or blockages, known as stenosis, caused by plaque buildup. This non-invasive test helps identify individuals at increased risk of stroke and guide decisions regarding preventive measures, such as medication or surgery. Echocardiography, also known as an echo, is an ultrasound of the heart that provides detailed images of its structure and function. This non-invasive test helps assess heart valve function, detect blood clots in the heart chambers, and identify any underlying heart conditions that could increase stroke risk, such as atrial fibrillation, a type of irregular heartbeat. The information gathered from an echocardiogram aids in stroke prevention and treatment planning. The impact of effective and timely stroke treatment cannot be overstated. It has the potential to prevent long-term disability and save lives. When strokes are recognized early and treated promptly, brain damage can be minimized, significantly improving outcomes for patients. Rehabilitation therapies, initiated as soon as possible after a stroke, play a crucial role in maximizing recovery and restoring function. With comprehensive care and unwavering support, individuals can regain their independence and enjoy a good quality of life after a stroke. As we've learned, stroke is a serious medical condition, but it's often preventable and treatable, especially with prompt action. Remember the acronym FAST and be vigilant about recognizing the warning signs. Time lost is brain lost, so if you or someone you know experiences stroke symptoms, call 911 immediately. Don't hesitate to seek medical attention for any concerns about stroke. Early detection and treatment are paramount in minimizing brain damage and improving outcomes. Take charge of your health, understand your risk factors, and work closely with your healthcare provider to develop a personalized stroke prevention plan. Remember, knowledge is power when it comes to stroke. By arming ourselves with information, we can protect our brain health and the well-being of our loved ones.